very much for that look at the weather. We are joined this morning by Jerome Garner from the Nash County Health Department. And Jerome, you're here to talk to us a little bit about a great event coming up this week, a diabetes conference.
Yes, this is the 5th annual diabetes conference that we are planning in the community, and we're excited to be having another one. And so it's coming up this Wednesday, actually, March the 31st from 2 p.m. to 6 p.m. at Nash Community College.
Okay, and this is a free event. That's open to people with diabetes and people that, like you said, are pre-diabetic.
Right, yes. This is a free public event open to anyone who's interested in learning more about diabetes. If someone have a family history of diabetes or taking care of a loved one with diabetes, and a person who is a diabetic themselves are encouraged to come out.
Okay, and now will you have any type of screenings or anything at the event?
Sure. We are doing free blood glucose screenings.
Okay.
And, you know, most people said blood sugar, but we are doing that, and we encourage residents to fast at least 4 hours before they come out so that they can get a better accurate reading of their blood sugar. But we have lots of other exciting activities of that day. We're having hearing checks, and we're doing vision screenings. We have some great speakers. We have two of our very own doctors in our community. We have Dr. Travella Sellers with Foot and Ankle Associates, and Dr. High of Watson Eye Care, and they're going to be coming to present some information about foot care and eye care. So we really encourage folks to come out and learn about controlling the complications related to diabetes.
Yeah, and this is something that's good because, you know, a lot of people get diagnosed with diabetes and they go, well, what happened? And then it gets explained to them and they go, well, I never thought eating this way or having these sorts of habits would cause diabetes. But something like this is a good way to educate people who maybe are just diagnosed, maybe have had it for a long time, to keep the blood glucose levels low, to keep it under control.
That's exactly right. You know, someone can control their diabetes by healthy eating healthy foods, staying away from those high sugar foods or high fat foods, or eating too many carbohydrates is what we like to say. And so, and with also increase in physical activity, you know, get off that couch, you know, get out there and do some yard work or get some exercise in. All helps out with controlling diabetes.
Yeah. Well, look, if you've got family history of diabetes, or if you have diabetes and you want to go to a great event, please come out to the diabetes conference.
Yeah, it's going to be like a conference because we're having line dance. How about that? Yeah.
It's this Wednesday, March 31st from 2 to 6 p.m. Now, this is not something where you come from 2 and stay to 6. You can come throughout.
Exactly. It's a floating event. Okay. Although we have some designated speakers time, at 3:30 and 4:30 we have specific speakers. So we really encourage folks to come on out. The event starts at 2 o'clock, and you're welcome to stay to 6. We have no problems with that. We have fun activities. Like I said, line dancing. We have cooking demonstrations to teach folks how to better cook healthy options at their homes. And so, great.
That's a great idea.
Yeah.
Yeah. Will there be materials that people can pick up to kind of keep around the house, books or brochures to look through?
We do. We have various different sponsors. We have a lot of medical providers locally in our community who, as well as the health department, is going to be bringing literature about diabetes management. And so we have tons of vendors. We have over 40 vendors that's going to be out there talking about different aspects of diabetes.
Okay, so if you want some resources to learn more about how to take care of this disease if you have been diagnosed with it, or if you're pre-diabetic and want to lower the risk of getting to the point of being diabetic, please come out to the event. Maybe you know somebody that has diabetes and you want to go out and get some material for them, or maybe learn a way that you can cook for somebody.
That's exactly right. I mean, you can't miss it. I mean, definitely, it's going to be an exciting event. Like I said, this is the 5th year this will be the 5th year we've planned the event, and it gets bigger and bigger every year. Last year we had about 300 folks, and we're expecting more because we're reaching out to more than just one county, Nash.
Yeah.
We're reaching out to Edgecombe, Nash, Wilson, Halifax, Franklin County. And so we couldn't do this without the support of the state. The state of North Carolina, a diabetes prevention and control branch, is really helping us plan this. And so we wrote off a grant. And so we were one of 4 counties in the state of North Carolina to get these grant funds. So again, we are excited.
Well, how many people do you have come to this event who are diabetic, and you show them how to do something, maybe take their blood sugar a little bit differently, and they go, I never did it that way. And you find out that they've been doing something, or there's something that just needs to be tweaked in their diet that they've been doing wrong that is keeping them from getting to a point of having it a little bit more under control. How many people do you run into that are in that situation?
Wow, we run into those folks every day in our clinics, in the community. And so, that's the beauty of this program. I mean, we have dietitians there. Okay, we have specialists there that will be able to help people with those specific questions. I had a gentleman call me last week, and he had some specifics around foot care. And with the lack of health care insurance these days, take advantage of these great opportunities that we have.
Absolutely.
I mean, things can be expensive. And sure, when you have something free, like a diabetes conference that's open to the public and free, hey, take advantage of it.
And learning how to manage your body and take control of certain things can prevent a lot of these problems down the road.
Exactly.
That with your feet and with your eyes, things that diabetes really affects.
The number one cause of blindness is related to diabetes. The number one cause of amputations is related to diabetes. I mean, just the latest statistics says that on average we have about 12,000 amputations in the United States a year, and they're all related to diabetes. And so, and if someone learn how to better manage their blood sugar, keep their blood sugar regulated on a daily basis, they can increase their life expectancy.
And again, even if you're not diabetic, this is a great way to learn how to put things in your lifestyle that will keep you from being that way. I know in my family, on my dad's side, a lot of the men are diabetic. So, trying to make those positive choices is sometimes difficult, but I know that I have to do it because as I get older, a lot of those things are more likely to be there than for somebody else.
And you brought up a very good point. Men have higher rates of diabetes than women, and a lot of people don't know that. And so, and as men, we also are relaxed about going to the doctor, and sometimes we need a little push by our female in our lives. And so, females, if you're out there, if you have a husband or a son or a grandfather with diabetes, please bring them on to the conference because they definitely can get something out of this.
And a lot of people, especially with where we are in the South, I think when they hear change in diet, they think, raw grass these crazy shakes, and water, and that's it. But there's really a lot of great things that you can incorporate into your diet that you are not going to say, I'm missing this or I'm missing that.
Right.
That you can cut out a lot of the fried foods and a lot of the sugary, the cakes and the sodas and stuff.
Right.
That you'll find, if I just replace it with the right things, I'm going to feel better. It's going to help my body. And it's going to be good for them.
Well, most people think it's all about the cakes, the sweets, and all that good stuff that we like. But it's a little bit more than that. It's about our choices. It's about making sure that we are eating the right serving sizes, making sure that we are having consistency in our meals, making sure those meals are balanced, making sure that we're not putting too much fat in our foods. And so it's a combination of all those kinds of things that will help us control not only diabetes, but in the long term, heart disease, cancer, all those other chronic health conditions that can related to unhealthy eating and the lack of physical activity.
And some of these changes, a lot of diabetics also have weight problems. Some of these changes can also help with the weight.
Exactly.
And that can, like you just said, it can have positive effects on other things like heart disease and other types of diseases.
Exactly.
So it's a good thing. Again, this is the Diabetes Conference this Wednesday from 2 to 6 p.m. There is a speaker at 3:30, Dr. Travella Sellers from the Foot and Ankle Associates, and Dr. High from Watson Eye Associates at 4:30, talking about foot and ankle care at 3:30 and eye care at 4:30. So you don't want to miss that. But go out there, get some tests taken on your blood, different things like that. Learn a healthy way to cook. A lot of great things and a lot of other great stuff. Line dance.
Yeah, line dance. We have a gentleman who's going to be teaching line dance. And, we're not saying you got to get out there and do that vigorous exercise and you got to go out and buy all these equipment. We have a beautiful community right here in the city of Rocky Mount, and certainly we want folks to get outside. And, there's some things that you can do, small things and small steps, and that, it doesn't cost anything.